Hello, everyone, and a very warm welcome to all of you. Today, we are diving into something incredibly important. We're going to decode one of the most critical health challenges of our time, drawing directly on the brilliant medical insights of Dr. Dipak Agrawal. So let's jump right into this explainer and learn how to truly protect our hearts. You might wake up in the middle of the night thinking, oh, it's just yesterday's heavy, spicy dinner causing acidity or gas. But what if your heart is actually telling you a completely different, much more urgent story? A key thing we need to understand right from the start is this. If your pain or discomfort actually increases when you exert yourself, like when you're walking or climbing the stairs, that is a classic hallmark of a cardiac issue. It is absolutely crucial that we do not ignore it. To really understand why this happens, let's look at how the heart works. Our heart beats tirelessly, constantly pumping blood to the entire body. But to do all that heavy lifting, the heart muscle itself needs a rich supply of blood, right? And this is delivered through the coronary arteries. Now, when these arteries get blocked up by fat and cholesterol, the blood supply to the heart is severely reduced, or sometimes it stops entirely. The heart just can't function, and this is exactly what we call coronary artery disease. And this is precisely why we have to take this so seriously. When those blockages happen, the outcomes can be devastating. We are looking at debilitating chest pain, a progressive weakening of the heart muscle that leads to heart failure, or, tragically, even sudden death. Now, this next point is a real game changer because there's a dangerous gap between the movies and reality. We all know the classic cinematic scene, right? A person tightly clutching the left side of their chest. But in reality, the symptoms are often completely misleading. For instance, back pain or right-sided chest pain is so frequently misunderstood as just muscle pain or spondylitis. Pain right in the upper center of your stomach, known as epigastric pain, is constantly brushed off as mere acidity. And jaw pain? People actually go to the dentist thinking it's just a bad toothache. These misleading signs can completely misguide us. If you experience these, especially if that pain increases on exertion, you need immediate medical advice. Section 2. Unmasking the risk factors. Let's move on and uncover the invisible culprits that are actually causing these dangerous blockages. Just look at this number for a second. This single digit represents a massive threat to our health. You see, if you are a smoker or if you have unmanaged diabetes, your risk of developing heart disease doesn't just go up a little, it is multiplied by 4 times compared to a healthy individual. Smoking heavily restricts your blood vessels and raises your blood pressure, while diabetes drastically increases the fat deposits building up inside those vessels. But beyond smoking and diabetes, we have to be on high alert if we have a family history. This is very important. If your parents or close blood relatives suffered from heart disease before the age of 60, you are genetically predisposed and you must be extra vigilant. Add to that high blood pressure, which stiffens up your arteries, and high cholesterol, which directly blocks them. And of course, we can't forget modern lifestyle factors like untreated mental stress and a lack of proper sleep. Put all of these together, and it's a perfect storm for your heart. Just taking a quick pause here. If you're finding this explainer helpful in decoding your health and understanding these vital medical facts, please hit that subscribe button and give us a like. It really helps us keep bringing you these crucial, life-saving insights. All right, let's keep going. Investigating the heart, the diagnostic path. Let's see exactly how doctors crack the case when a patient rushes into the hospital with these suspicious symptoms. The doctor's toolkit flows in a very logical way. First up is the ECG. It's incredibly fast and simple, but it does have its limits. Sometimes it can miss a heart attack completely. That is exactly why doctors rely on the troponin test. This is a highly specific blood test that detects actual physical injury to the heart muscle. After that, an echocardiography, or an echo, gives a very clear visual of how well the heart is actually pumping. And finally, to see the absolute truth of exactly where and how severe those blockages are, an angiography is performed. These 4 investigations are the absolute key to getting a proper diagnosis. The rescue, the golden hours. Now, the absolute most crucial point is what happens the exact moment those deceptive symptoms strike. Here is that number 4 again, but this time it represents hope. The first 4 hours after your symptoms begin are known in the medical world as the golden hours. This is the critical window where immediate, precise action literally separates life from death. Listen very carefully to this part. In this critical window, whatever you do, do not let the patient walk. Any exertion is just going to damage the heart further. Rush them to the hospital immediately. Once there, doctors will administer life-saving blood thinners like aspirin, clopidogrel, and heparin. They might also use clot-busting drugs like streptokinase or tenecteplase. But please, heed this strict warning. Do not ever self-administer pills like sorbitrate or isosorbide dinitrate without consulting a physician. Doing so can cause a sudden, severe drop in blood pressure known as hypotension, which can actually be fatal. Once the patient is safely in medical hands, interventions like thrombolysis to dissolve clots or an angioplasty and bypass surgery are truly life-saving procedures that can completely repair the damage. Shielding your heart for life. Let's transition away from emergency response and talk about lifelong protection. So, how do we proactively shield our hearts before an emergency ever happens? The foundational step is beautifully simple, and you don't even need a pharmacy for it. It just requires your commitment. 45 minutes of aerobic exercise. Think brisk walking, cycling, or swimming, just 5 days a week. It keeps the heart muscle incredibly strong and those blood vessels nice and flexible. Your diet, of course, plays a massive role too. This table clearly separates the dietary hazards from the shields. We absolutely must cut out trans fats and refined carbs like dalda, maida, and fast food. Instead, we need to embrace a diet rich in fresh vegetables, fruits, almonds, walnuts, and flax seeds. And here's a golden rule straight from Dr. Agrawal. Always eat slightly less than your full hunger capacity. It just prevents you from overburdening your entire system. Finally, to really guarantee your long-term safety, certain lifestyle controls are completely non-negotiable. Quitting smoking immediately is absolutely paramount. You have to keep your blood pressure and blood sugar strictly under control. Managing your cholesterol is equally critical, and for many people, medications like statins are highly effective and totally vital for prevention. Pair all of that with proper restful sleep, and you build an incredibly strong, lifelong shield for your heart. So we've unmasked the hidden signs, explored the essential investigations, and laid out the exact lifestyle shields today. Your heart works tirelessly for you, beating 100,000 times a day without you even having to ask. I want to leave you with this final, vital question. Armed with all this knowledge, what one change will you make today to protect it? Thank you so much for joining me in this explainer. Stay informed, and please, stay healthy.